I'm involved in a telemedicine project in Ghana where we try to bridge the gap between the community health workers in the rural areas and the specialists in a city, or if need be in Basel or in New York or wherever they are. Because community health workers know a lot, but there is a limit to what they can do, and that gap can be bridged by giving them access by telephone or by computer or by electronic means to talk to specialists. You know, if you do a project like this, you have to run a pilot in a way, and we wanted to run that pilot in Millennium Village, because the first way to upscale would be going into all the 90 plus Millennium Villages and then going into the different states. And we have good governance in that country, meaning you talk to politicians who are accountable, who are responsible. You can rely on what they say. You have an infrastructural environment that allows at least connectivity. And so, you know, that was chosen because of the good environment we are working in. It's not broadband yet. It is wireless. It is telephone, so to say. Ericsson was kind enough to look for the connectivity. They were putting up the transmission poles, and you can call, and that's for the moment what is possible. A next step would be that you use computers that have a small camera, and then you interact like this. But sooner or later you need a broadband to really use the optimum that you can use. These are trained health work, and you know, all over the world you find people who can manage, let's say, 75% of the morbidity and prevent 80% of the mortality, because these are primary care issues, relatively simple diseases. And these are also low-hanging fruits, because, you know, if you intervene appropriately with the means we have today and with the inexpensive means we have today, you could achieve a lot. But then, as I said, there are limits, and if they see a problem that they cannot deal with, in the past, they would have to make a choice, and that choice can be right or can be wrong. And today, they can, in a first phase, call other colleagues and then call into a call center with medical doctors. And the result of that conversation would basically be, this is something you can do, but you have to do it differently. Or this is something you cannot do, so go and see a doctor or go to a hospital in the next 2-3 days. Or we send an ambulance immediately, because this is not only something you cannot do, this is very urgent. So by this you have a triage that also saves lives. I think it's the future. Not only, if you look at the Swiss model, there's a Swiss model called Medgate, where patients can call into consultation centers. And 80% of the inquiries can be done on phone, saving these patients to go and see a doctor. They can also do prescription over the phone. So especially for handicapped people or for old people, this might be a huge progress. But the second thing is, once you are electronically interacting, you can also compare data, or you can transfer data. Health is one group. I'm a member of the health group. Jeff Sachs is there. He is the chairman of that health group. And it's basically, you see, it seems that there are a lot of activities and a lot of initiatives going on. And, you know, there is a lot of reinventing the wheel. And if that commission has one function, it is to bring actors together who are already engaged, who are already convinced, and kind of streamline what they are doing. I have proposed this morning that we should, at the next commission meeting in October, spend half a day and invite 10 initiatives who have proven the concept, who have a measurable impact, so that then others can say, oh, I'm doing a similar things, but as you are so far, let me forget about my initiative and let's take yours. You know, let's look for the targets to be achieved rather for our flag being on their own house.